Welcome to the clinical demonstration on suturing. In this video, we will guide you through the proper techniques of suturing. So let's see the different instruments required for suturing. Starting with the needle holding forceps or needle holder. As you can see, this has a lock to ensure we have a proper grip of our suture material, and this has a serrated end to ensure that the needle stays in place. This is a cutting scissor with sharp edges. This is a toothed forceps. It is required to hold the tissue, and also we can handle the needle with this toothed forceps. And this is the syringe loaded with the local anesthetic, and these are the suture materials. The synthetic ones include Vicryl, Proline, Ethlon, and PDS, and so many others also. Another classification is the absorbable suture materials and non-absorbable suture materials. Absorbable sutures are put in places where suture removal is difficult, like when we are suturing the parts inside the body, or where the suture removal is difficult, like in children, or sutures put in perineum, inside the eyes, etc. Non-absorbable sutures are put where we require the suture to stay for a longer time, and where suture removal is not very difficult. There are certain things that should be taken care of before we start suturing, and the first one is an informed and a written consent that should be written ideally by the patient or the bystander in the language that is understandable to them. And the second one is aseptic precautions. Suturing is an invasive procedure, so we have to make sure that we do not introduce any more infection to the patient. So strict aseptic precautions should be maintained before starting of the suturing. The wound have to be cleaned thoroughly, and we have to make sure that no foreign material like any mud particles or any debris is not left within the wound, because that might cause wound infection later. And the third thing is local anesthesia. We have to anesthetize the part before proceeding with suturing. So we use local anesthetic for this purpose. The local anesthetic which is commonly used in the present clinical scenario is lignocaine, and it comes either plain lignocaine or mixed with adrenaline. Now we can move on to the actual procedure. So we have a mannequin here, and imagine that consent is taken, the wound body part is properly cleaned, and local anesthesia is given. We'll start with suturing. Suture material is opened in a sterile way and put into a sterile tray where the other sterile instruments are kept. So this is the suture material. In this video, we are using the suture material called silk. And it is loaded onto the needle holder, and the needle holder is kept on the junction of proximal 1/3 and a distal 2/3 of the needle in this way. This is the way we lock the needle holder. So the locking is complete. In order to unlock, apply pressure in the same direction and pull back. So the lock is released. Simple interrupted suturing method is going to be demonstrated here. Hold the tissue with a toothed forceps, and needle should be applied perpendicular to the skin so that it ensures maximum tissue is caught between the bites. And pronate your wrist so that the needle comes out of the center of the wound. Then release the needle holder and take out the needle. Pull it until there is approximately 3 cm of suture material left on this side, so that when we are tugging with the suture material, it doesn't come off easily. Reload the needle onto the needle holder and raise the opposite flap with the forceps and take the bite. Pull this out, and now we can adjust the length of the remaining suture material to ensure minimum quantity is wasted. When we are suturing, make sure that the bites are taken exactly at the equal distance from the wound margin, and the depth is also similar to ensure adequate wound approximation. Now we are going for our first knot. Imagine this as a V, and the needle holder or any other forceps should always come inside the V on the longer segment of the suture material. And for the first knot, we have to throw 2 throws over the needle holder. 1, 2 throws away from us. Hold the tip of the suture material and pull the needle holder towards us so that the first knot is secured. Don't make it too tight. For the second knot, follow the same steps and keep the needle holder here, but only one throw is required. Single throw, hold the tip of the suture material and tighten the knot. So the third knot, one throw away from us, hold the tip of the suture material and pull the needle holder towards us. After this, we have to secure the knot to the side of the wound. The knot shouldn't lie exactly above the wound because that will create discomfort to the patient. We are going to cut the remaining suture material. Ensure that there is approximately 5 to 6 millimeters of suture material. If it's cut very short, it will be difficult during removal, and if it's too long, it will interfere with the next bites we are taking. Now we are going for the second suture of the simple interrupted suture. Similarly, interrupted sutures are put until the wound is fully closed. This is simple interrupted sutures. In the removal of sutures, hold the end of this knot and pull it above, and make sure that you cut only one limb of the suture material so that complete suture material is taken out.